welcome back to my channel. And if you are visiting my channel for the first time, you are also highly welcome. In this lecture, we would be looking at side identification of the scapula. In case we are given during examination, it will be easy for us to identify whether it is the scapula of the right or of the left side. So in trying to identify whether the scapula given is of the right or the left side, it is important that the scapula is placed in its anatomical position. So anatomical position of the scapula is key in this regard. And one of the factors that will be considered here are the surfaces. We know that the scapula has two surfaces. It has the anterior surface and also the posterior surface. These surfaces should be placed in their normal anatomical positions, which means that the anterior surface must be placed anteriorly, and also the posterior surface must be placed posteriorly. So using this image by the side, this is the posterior surface of the scapula, and at this inferior region is where we have the anterior surface of the scapula. Within the anterior surface of the scapula, we know we have an indentation that is referred to as the subscapular fossa. So this indentation that is created here is used to identify the anterior surface of the scapula, and this surface is placed anteriorly. And if you go more at the superior region, this is where we have the posterior surface. We know that on the posterior surface, we have a distinct feature around this region, and this is the spine of the scapula. This is where we have the spine of the scapula here, harrowed in purple. It is the spine that runs horizontally along the posterior surface of the scapula. And this is what we say divides the posterior surface of the scapula into two fossae. We've tried to describe this in our previous lecture on the scapula. If you've not checked that lecture up, please kindly go and do so. So the distinct feature that we have on the posterior surface of the scapula is the spine of the scapula, and this is what is projected here. So having established or placed the anterior and the posterior surfaces accordingly, the next factor that we should consider is the glenoid fossa. The glenoid fossa is an indentation that is created on the lateral border of the scapula, and this is what receives the head of the humerus. This glenoid fossa should be placed laterally. So if you try to use this image here, this is where we have the glenoid fossa harrowed in red, and this is the medial border, and on this lateral side is where we have the lateral border. So you can see that the glenoid fossa is directed laterally. And if you look to the other end here, where we have the second scapula, it is also seen to be directed laterally, because it is only at this lateral region that it will be able to receive the head of the humerus. So this is where we have the head of the humerus that will be fixed into the glenoid fossa to form the glenohumeral joint or the shoulder joint. And also on this side, we have the head of the humerus also fixed into the glenoid fossa at this lateral region. So you ensure that the glenoid fossa are directed laterally, because it is only at that lateral point or region that they can receive the head of the humerus to form the glenohumeral joint. It is also important that we orientate the coracoid process and also the acromion. The coracoid process is directed forward, and it is seen like a big light projection above the glenoid fossa. And also we have the acromion, which is an expansion of the spine of the scapula. Remember, we described the spine of the scapula at this posterior surface that is harrowed here in purple. At this lateral region, it becomes expanded, and this is why it becomes the acromion. This acromion is seen to be directed anteriorly, and the basis behind this anterior direction is for it to be able to fix or accept the clavicle. We know that the clavicle is located in the anterior region. So the acromion is seen to be directed anteriorly for it to be able to connect or unite with the clavicle that is located in the anterior region. So if you place the scapula according to the highlighted points or factors, you would be able to deduce whether it is the left or the right scapula. I hope that you find this video useful. Thanks for watching.